Nervous system regulation through listening, the science and applications. Unite Health. An introduction to listening therapy. Therapeutic applications in music and sound have expanded tremendously in recent years. Institutions like the National Institutes of Health, NIH, have published calls to action with ongoing funding opportunities for music and health research. A 2023 virtual conference, Music as Medicine, the Science and Clinical Practice, sponsored by the NIH and the National Endowment for the Arts, NEA, featured over 100 speakers and panelists across disciplines, highlighting both advancements in scientific research on music and health. Terminology. Music-based interventions can include a wide range of applications, including playing or singing music, listening to music, and integrating music with a therapeutic process. Music therapy is defined by the American Music Therapy Association, AMTA, as the use of goal-based music interventions within a therapeutic relationship and recognized as an accredited profession. While licensed music therapists have a unique professional lens and training, many other disciplines and modalities also use music-based interventions to support healing. Sound therapy or sound-based interventions use audible sound vibration to facilitate changes to allow for therapeutic or healing responses. Include the use of specific sounds or instruments that center various cultures or traditional practices, such as drumming, singing bowls, and gongs, and may be used in community, spiritual, clinical, or other therapeutic contexts. Listening therapies are considered to use specific sound qualities alongside a therapeutic process that centers the client's participation in the experience. Listening therapies include various programs, technologies, and theoretical orientations, including Unite's evidence-based programs. They may be applied by practitioners in clinical settings or delivered to support general health and well-being. The terms music-based intervention, sound, and listening therapy will be used throughout this white paper to describe the many applications of music across populations and disciplines. Why listening and why now? Listening is built into our nervous systems based on a biological imperative to socially engage with others and respond to cues in our environment. Porges, 2001. The ability to create and perceive sounds that support safety, connection, and communication have been essential to human life from the earliest days. The Fable 2017 describes the history of music and the human experience and how specific pitch patterns, cadences, and rhythms are embedded in our evolutionary history. As ancient knowledge in music and sound converges with new learnings in neuroscience and clinical practice, the potential for healing and recovery continues to unfold, empowered by modern technology. There's a tremendous need for better and more effective tools in healthcare, particularly to support individuals with mental health-related and neurodevelopmental challenges. Despite technical advancements in pharmacology over the past 40 years, we're still experiencing the highest incidences of mental illness in history. The National Alliance on Mental Health, NAMI, reports that 1 in 5 U.S. adults experience mental illness each year, with young adults 18 to 25 being the most prevalent. A growing proportion of adolescents 12 to 17 are similarly challenged, evidenced by a 31% increase in mental health-related emergency department visits in 2020. Globally, the World Health Organization estimates that 1 in 8 people and 14% of the 10 to 19-year-olds are currently experiencing a mental health condition. Anxiety and depression are most commonly reported. The prevalence rates of autism spectrum disorder have increased from 1 in 150 in 2000 to 1 in 36 in 2020. We need better alternatives and further advancements to address this need. And neurodevelopmental and mental health challenges have a holistic impact on overall function, including emotions, thoughts, behavior, and physical health. There's a need for solutions that address the root cause of these categories. The benefits of integrative approaches like listening therapies include low risk, low cost, non-invasive, accessible, and integrative. In an economic analysis, patient-directed music interventions, music tailored to individual preference by a board-certified music therapist, saved $2,322 per patient and currently better managed anxiety with less sedative medication than usual care for ICU patients, supporting the cost effectiveness of including music in therapeutic approach. Shifting the narrative from just treating a condition to supporting mental wellness through each individual's innate capacity for healing. Approaches that overly focus on symptoms miss the root cause, limiting growth and restoration. Integrative approaches that combine body-up, body-based feeling alongside the top-down cognitive thinking are rapidly developing to meet this need. Modalities and therapeutic approaches like somatic therapies, sensory processing and integration, EMDR, internal family systems, and sound and music therapy are already helping hundreds of thousands of people unlock their nervous system's innate ability to heal, enabling them to lead more connected, regulated, and resilient lives. These new approaches are still only known by and accessible to a small segment of the population. Broader awareness among healthcare institutions, providers, and payers is essential to make these evidence-based treatments more broadly available to those who are in need, and ultimately to help curb the growing global mental health crisis. This paper is one step towards broadening the awareness of the current and potential for future impact of evidence-based integrative therapeutic approaches like listening therapies. The science. Beyond ancient wisdom, emerging clinical needs, and practical advantages in the modern world, the science of how music affects the brain and body has accelerated in recent years. We know now that music evokes many brain regions and enhances autonomic regulation, leading to better therapeutic outcomes and well-being. This understanding is evidenced by the work of many researchers and clinicians, spreading across disciplines of neuroscience, music therapy, and health care. Neuroplasticity, bridging theory and practice. Neuroplasticity helps us understand how music promotes changes in the brain. Neuroplasticity is a dynamic process that occurs on various levels, from individual neurons to entire brain regions. Through functional and structural plasticity and neurochemical changes, neural pathways have the capacity to change the magnitude and direction of their connections, resulting in a reorganization of how the brain responds to stimuli. These changes can manifest in shifts in affect, behaviors, sensory processing, executive, social, and other functioning. Neuroplastic change can occur throughout the lifespan, giving therapists a unique opportunity to implement tools to create positive shifts in brain function at any age. Music-based interventions are found to be effective methods to promote neuroplasticity. At a structural level, music induces neurogenesis, the formation of new neurons, and promotes dendritic spine growth perfusions on the neurons responsible for receiving input from neighboring neurons. Music-induced plastic changes are also expressed through functional shifts at the synapses, where communication between neurons occurs, and through cortical remapping by adapting brain regions' responses to sensory inputs such as motor, speech, and auditory processing changes. Finally, neurochemical changes such as those in the dopaminergic and serotogenic systems map onto the changes observed in mood regulation, emotional processing, learning, memory, and motivation following music exposure. In a review of articles addressing the effects of music on PTSD, researchers found that music can stimulate neuroplasticity, enhance brain recovery, and normalize the stress response for individuals with PTSD. These plastic-induced changes are expressed through structural and functional changes in areas involved in emotion and memory, namely the hippocampus, hypothalamus, amygdala, and nucleus accumbens. Further, music listening has been attributed with modulating the stress response by balancing the hypothalamic pituitary adrenal axis, observed through consistent reductions in biological markers of stress, such as lowered cortisol and blood glucose levels following music listening. Music has also been observed to enhance dendritic spine density in preclinical trials. Papadakis and colleagues exposed animal models to 12 hours a day of Mozart for 55 days following the stressor of maternal separation. The group receiving the music intervention demonstrated significantly increased hypothalamic dendritic spine count, reduced depression and anxiety, and improved sociability compared to the control group. Music-induced neuroplastic changes are involved in the rewiring of sensory, motor, and language areas. Chauvanin and colleagues found that a large body of evidence in using music for neurological rehabilitation, especially for individuals with stroke and dementia, and pointed to the neural circuits involved in reward, arousal, affect regulation, and learning as being prominently involved. These circuits are governed largely by dopaminergic and serotonergic neurons, underlying the long-standing relationship between music and pleasure. Many of the projections touch base in the key pleasure centers in the human brain and the nucleus accumbens, and has been shown to have increased extracellular dopamine and serotonin following music exposure. Dopamine also drives neuroplasticity by playing a vital role in strengthening neural connections between regions through long-term potentiation. Menon and Levitine conducted a brain imaging study that examined the functional connectivity of reward pathways while participants listened to classical music. The music provoked a linking between responses in the nucleus accumbens and fellow reward center, the ventral tegmented area, as well as brain regions that mediate physiological and cognitive responses to rewarding and emotional stimuli, such as the hypothalamus, insula, orbitofrontal region. By strengthening functional connectivity of these pathways that influence motivation, reward, and learning, music stimuli can cultivate an enhanced learning environment for non-music tasks and behaviors. For example, in a case study of cerebellar stroke patients, combining music alongside physiotherapy led to improved self-motivation and rehabilitation and promoted therapeutic goals. while including functional movements, coordination, balance, fluency of speaking, and multitasking. The exploration of neuroplasticity and its intricate connection to music provides insight into the transformative impact of music on the brain. From cellular to global levels, music-induced neuroplastic changes manifest in diverse functional shifts influencing affect behavior, sensory processing, and cognitive functioning, highlighting music's profound potential to enhance therapeutic outcomes. Autonomic regulation. Beyond neuroplastic changes, listening therapies can profoundly improve physiological functioning through autonomic mechanisms. The autonomic nervous system mediates our essential physiological functions. It integrates the brain and body through an extensive network of nerves operating beyond our conscious control. Its holistic influence extends to sensory perception, eyes, mouth, skin, the cardiovascular system, heart and lungs, cardiovascular system, stomach, bowel, and bladder, reproductive system, immune system, hormonal regulation, and more. Due to its holistic influence, shifts in autonomic state can lead to a cascade of physiological changes, with the potential to enhance healing and restoration in a broad range of mental and physical conditions. One perspective of how music influences health is termed neurovisceral integration, NVI. This describes a dynamic interaction between the central and autonomic nervous system as self-organizing and non-linear, explaining how music globally influences physiology, leading to functional changes in health and well-being. The therapeutic impact of improving autonomic regulation through listening is evidenced in several high-quality studies. Listening therapies were found to reduce the stress response in individuals with symptoms of trauma and have a global effect on physiological markers of health, including heart rate, blood pressure, respiratory rate, electrodermal activity, and hormone regulation. Further, music-based interventions have been found to significantly improve heart rate variability, a measure of autonomic regulation, an indicator of enhanced parasympathetic activity. Clinical outcomes. The impact of music-induced neuroplastic and autonomic changes are demonstrated through clinical outcomes across diverse populations. Mental health and trauma. 10 randomized controlled trials featuring participants with schizophrenia, insomnia, mood disorders, and dementia showed significant improvements in quality of life, social functioning, mental health, sleep, stress, communication, and memory. The impact of music-based interventions on supporting individuals with PTSD and trauma-related systems is well evidenced. Integrating music into a trauma-focused group therapy program led to reductions in PTSD symptoms, in addition to improvements in dissociation, anxiety, and depression. Similar findings were reported in a mixed method study by Story and Beck, including effective use of classical music in reducing PTSD symptoms, decreasing arousal, and improving emotional regulation, communication, and connection. Other forms of non-vocal music seem to have a similar impact too, as demonstrating in a reduction of PTSD symptoms following the delivery of soothing music featuring nature sounds to mothers of premature infants hospitalized in a neonatal intensive care unit and ICU. A stressful experience for mother and child. Bottom up versus top down. Compared to traditional talk therapies considered top down, music is a universal language that can increase accessibility to mental health care across cultures. Listening therapies, bottom up or integrative, are an evidence-based alternative that have been found to achieve powerful results. A trauma-informed neurobiological music program was found to reduce hyperarousal and increase attention and focus in high-risk forensic patients with PTSD who were unresponsive to or unable to participate in other therapies. They found that music therapy has a similar or better outcome compared to standard therapies with refugees, and with much higher adherence and participation. Zergani and Nodera in 2016 exposed veterans with PTSD to traditional cultural music, which led to improved quality of life and anxiety symptoms, with effects persisting at a 1-month follow-up. This is consistent with findings on the power of music to reduce physiological markers on anxiety. While cognitive behavioral therapy is considered an evidence-based psychological intervention, the benefits of CBT may not extend to often hard-to-reach individuals living with symptoms of severe trauma. Participants with PTSD who had previously received CBT without meaningful change reported a significant reduction in PTSD and depression symptoms following a group music therapy program. Autism. Research on listening therapies to support individuals with autism is equally compelling, validated by a growing evidence base that includes clinical trials at Unite's Safe and Sound Protocol, formerly known as the Listening Project Protocol. Music can motivate and inspire while facilitating improvements in motor, speech, and executive functions, memory and attention, mental health, and well-being, as found across populations including individuals with autism, stroke, dementia, Parkinson's, epilepsy, and multiple sclerosis. Informed by an understanding of neuroplasticity, these changes are often found to be long-lasting, with some studies reporting functional gains that continue 6 months and beyond. Neurorehabilitation and pain. It is clear that music and movement share an intimate relationship in our neural circuitry. Paul and colleagues report that pairing rhythmic movements like clapping or stomping with music improved mobility, recall, and quality of life when compared to standard care for patients with Parkinson's disease. Further, by stimulating the connectivity of auditory and motor brain regions, music has been found to support the learning and relearning of motor patterns, applied in both neurological rehabilitation and sports performance. A systematic review and meta-analysis of The Lancet describes the efficacy of listening to music in enhancing physical recovery, evidenced by lower levels of pain and anxiety, less use of analgesics, and higher patient satisfaction. Listening to music also lowers stress hormones, cortisol, and improves bonding, oxytocin, and regulation essential for healing, as demonstrated in post-operative patients. Seizure. Music seems to penetrate neural activity deep within the brain in mysterious ways. In a 3-year blinded, randomized, controlled trial, they found that listening to classical music during the night significantly reduced seizure activity in patients with neurological differences. Amazingly, 80% of treatment participants experienced a decrease in seizures, with 24% having a complete absence of seizures during the treatment year. While the exact mechanisms are undetermined, these findings demonstrate the potential of music to restore optimal neurological activity.